Hi there, I'm Carolyn, Trichologist here at Absolique Hair Health Clinic. We're coming to use our first video for the year 2023. We're in January and we want to talk to you today about something that I keep seeing in the clinic and so much since I've come back to work this year is hair shedding following the COVID-19 infection. Now I have seen it over the years, but it's increasing because there have been a lot of infections, and what I'm specifically seeing is it's occurring much sooner after the infection than we would normally have hair loss from a disturbance in the body. So normally it's to do with the hair cycle. So once you have a disturbance in the body, or an event we would call it, it will take 3 months for the hair to fall out. But I'm seeing it occurring sometimes 2 weeks later, 3 weeks, and up to 2 months. So it's much sooner. And what we're finding is there's a lot of common denominators in these people that are seeking my help, which is why it's happening to them much sooner, and why in specific it is happening to them. So why does COVID cause hair loss? Okay, so we have this thing called the hair cycle. It's a growing, resting and falling phase. It's called the anagen, growing phase. Catagen, resting, goes into telogen, is the falling. The hair falls out, returning back into the growing phase. Now that's happening to every hair on our head all the time, every day. It always has been. But when there's disturbances in the body, it can disturb the growing phase, the anagen growing phase. Now normally that disturbance will take 3 months to push the hair out, because the hairs, they're really locked in, they're really anchored in by these bulbs. But for some people, what I'm seeing is when they're having this earlier telogen effluvium, it's called, that we're finding that they've got a lot of nutritional lows. Okay, so they're not deficiencies, but we're looking at blood work, and the blood work is the key here, is we're identifying that they had low levels. Okay, so they didn't get very sick, which is interesting, that some of them had really strong immunity, meaning their hematology is really, really good, but they may have had low iron is one of them, low ferritin, I'm seeing a lot of, low vitamin D3, and low B12. Okay, so I'm going to put a study here in a link so you can go through and read about it. So this is a real thing. But what they're saying in the study is that for the people who are showing this post-COVID hair loss, they had normal blood ranges. But what I'm seeing is normal is indicated, let's use an example of ferritin. Ferritin is the storage of your iron. In Australia, it has a reference range of 30 to 300. So you're deemed normal if you're at 35, okay? But if you've got COVID and you've got such a low level of ferritin, it's nearly a state of hair loss on its own. 30 is a state of hair loss, but for hair growth, for the hair to even try and regrow back, it needs to be 70 to 100. So as for health, even better immunity, and hair growth, the ferritin needs to be 70 and to 100. So your other vitamin D3 and your B12 and your iron levels, they have very specific numbers as well that we need for health and hair growth. Okay, so that's not being looked at. So every case I've seen come to me for help with this post-COVID hair loss, they've got low levels, but they're not medically deficient. So I'm really saying to you, if you're experiencing this post-COVID hair loss, please go and get your bloods checked. And if you want to send them my way, we can have a look for you, do a 15-minute consultation. So we've talked about the hair cycle, and it's the disturbance of the hair cycle that can cause the hair loss. Okay, it should last for no more than 3 months. So if you have hair loss post 3 months, something else is going on. Okay, so 3 months is your mark. If it hasn't stopped, you need to get some help. Okay, so that's where we can come in and say, if we need to, we can teach the hair how to come back into its cycle. Okay, we use products for this type of thing. You've heard me talk about Activance many times, and we've also got our GRN. They both do a similar thing. Sometimes if it's really severe, I might need to use both. And what we do is we use safe. I only use safe ingredients. Safe topical products, so we apply to the top to tell the cycle to come back in, get back into your growing phase, okay? So we can actually come in and help to slow the hair loss. I can't stop it, but as we're slowing the hair loss, we're promoting hair growth. So if you leave it on its own, the hair loss should stop after 3 months, okay? But it may take 12 months to actually come back into its cycle. But you can come in and use products. There's lots of other products around, but ours are just safe ingredients to push it back into its cycle as a hair growth treatment as well. I would not use those on their own unless you check your bloods, okay? If you do have low ferritin or one of those other ones that I spoke about, they can help to slow the hair loss, but you won't get hair growth unless there's actual sufficiency in the body, okay? So I'm here in Brisbane, and we can help you anywhere in the world. If you're experiencing the post-COVID hair loss, you have some questions, or you need some help to get some hair growth if it's continuing on, please reach out to me. My email is info@absolique.com.au.